Good day, BS in Pharmacy 1C. I am John McLean M. Flauta, and together with my fellow group members, we are going to discuss the components of the healthcare system. Next slide. At the end of this lesson, the student will be able to demonstrate understanding on the components of the healthcare system. Identify the different elements or components in a pharmacy operation while practicing good management skills. Next slide. The healthcare system consists of all personal medical care services, prevention, diagnosis, treatment, and rehabilitation, plus the institutions and personnel that provides these services and the government, public, and private organizations. Personal care services are hands-on services that assist a person with critical day-to-day activities that are unable to perform on their own. Preventive healthcare deals with the prevention of illness to decrease the burden of disease and associated health factors. Preventative measures can be applied at all stages across the lifespan and along a disease spectrum to prevent further decline over time. Diagnosis is the process of identifying a disease, condition, or injury from its signs and symptoms. Medical treatment means the management of care of a patient to combat disease or disorder. Rehabilitation is defined as a set of intervention designed to optimize functioning and reduce disability in individuals with health conditions and interaction with their environment. Government, public, and private organizations means any program that provides health benefits, whether directly through insurance or otherwise, and that is funded directly in whole or in part. The healthcare system may be viewed as a complex made up of three interrelated components. These are the healthcare consumers, healthcare providers, and the institutions of organizations of the healthcare system. Healthcare consumers are people who use health services, as well as their family and carers. This includes people who have used a healthcare service in the past or who could potentially use the service in the future. Healthcare providers include hospitals, doctors, nursing staff, clinics, nursing homes, medical practitioners, nutritionists, dietitians, and many more. Hospitals, clinics, and nursing homes are the places where patients come to get a diagnosis for any injury or disease. Healthcare institutions and organizations are the companies that provide offerings to clinical authorities like nurses, doctors, pharmacists, and many others. Their fundamental purpose is to provide well-being services at lower price and in better amounts so that these may also be made on hand to a tremendous number of members. The healthcare system consists of all the organizations, institutions, resources, and people whose primary purpose is to improve health. The key component of a well-functioning health system should include leadership and governance, financing, health workforce, healthcare products, healthcare infrastructure, and health information systems. Leadership and governance involve assurance that a strategic policy framework exists and are combined with effective insight, coalition building, regulation, attention to system design, and accountability. Financing aims to raise adequate funds for health in ways that ensures people can use needed services and are protected from financial catastrophe or impoverishment associated with having to pay for them. It provides incentives for providers and users to be efficient. A healthcare workforce works in a way that are responsive, fair, and efficient to achieve the best health outcomes possible, given available resources and circumstances. Equitable access to essential medical products, vaccines, and technologies of assured quality, safety, efficacy, and cost-effectiveness, and their scientifically sound and cost-effective use. Healthcare infrastructure service delivery can be defined as the way inputs are combined to allow the delivery of a series of interventions or health actions. Lastly, health information systems ensure the production, analysis, dissemination, and use of reliable and timely information on health determinants, health system performance, and health status. The next reporter will discuss the WHO healthcare facilities.
Good afternoon, everyone. I am Jasmine Ditahad and I will be reporting the WHO Healthcare Facility. So, fun fact, the World Health Organization is a specialized agency of the United Nations responsible for international public health. The WHO Constitution states its main objectives as the attainment by all people of the highest possible level of health. The World Health Organization uses three levels to categorize healthcare facility. Level 1 is small hospitals and health center. Level 2, district or provincial hospital. And level 3, referral hospitals. So according to WHO, every level of facility may different typical structure, treatment capabilities, and procedures. So the typical infrastructure for level 1 is small number of beds, sparsely equipped procedure or operating room. So sa level 1 facilities, merong small number of beds at operating room pero hindi siya malaki. For minor surgeries lang siya. The typical infrastructure for level 2 facilities, there are 100 to 300 beds adequately equipped with major and minor operating rooms. Sa level 2 facilities daw, meron silang capacity ng 100 to 300 beds, tapos may major and minor operating rooms sila. The typical infrastructure for level 3 facilities, there are 300 to 1,000 or more beds, adequately equipped with ORs and intensive care facilities or intensive care units. Yung level 3 facilities may capacity daw na 300 to 1,000 or more beds. May OR din siya, pero ang kinaibahan nilang sa level 2 is yung level 3 ay may intensive care facilities. Now, let's go on to the treatment capabilities of each level of facility. For level 1, emergency treatment of 90 to 95% of trauma and obstetric cases, excluding cesarean delivery. Referral to other patients to a higher level of facility. Level 2, short-term treatment of 95 to 99% of major life-threatening conditions. And for level 3, same as level 2 with addition of intensive care treatment. Now, let's go on to the procedure on each level of facility. On level 1, the procedures we can do are normal vaginal delivery, uterine evacuation, circumcision, hydrocele reduction, incision and drainage, wound suturing, control of hemorrhage with pressure dressing, debridement and dressing of wounds, temporary reduction of fractures, cleaning and or stabilization of open and closed fractures, and chest drainage. On a level 2 facilities, the procedure we can do are the same as level 1 but with following additions: cesarean delivery, laparotomy, amputation, hernia repair, tubial ligation, closed fracture treatment and application of plaster of Paris, eye operation including cataract extraction, removal of foreign bodies, example from the airway, emergency ventilation and airway management for referred patients such as those with chest and head injuries. In level 3 facilities, the procedure we can do are the same as level 1 but with following addition: facial and intracranial surgery, bowel surgery, pediatric and neonatal surgery, thoracic surgery, major eye surgery, major gynecologic surgery, example, vesicovaginal repair. Next slide please. These are the comparison of levels of the healthcare system according to World Health Organization. For level 1, minor surgeries, in some cases requiring anesthesia. For level 2, cesarean delivery, laparotomy, and a range of emergency and selective procedures. And in level 3, subspecialty and more complex surgery, intensive care treatment. According to Lancet Commission on Global Surgery, primary health care or the level 1 facility should handle minor procedures not requiring anesthesia. Referral to first level hospital. So, first level or the district hospital, according to Lancet Commission on Global Surgery, should have the core site of surgical and anesthesia care delivery, provision of the bellwether procedures such as laparotomy, cesarean delivery, treatment of open fractures, indicative of a surgical system advanced enough to do most other surgical procedures. According to the Lancet Commission on Global Surgery, the level 3 facilities, or they called it as higher level secondary or tertiary hospital, should have care specialization hub for system-wide clinical education and research support. According to disease control priorities, community facility and primary health care, or also known as level 1 healthcare facilities, should only have minor procedures not requiring anesthesia. For example, dental extraction, drainage of superficial abscess. Disease control priority states that level 2 facilities or the first level district hospital should have a similar procedure to Lancet Commission on Global Surgery, bellwether procedure, and a range of other emergencies and elective surgery should be conducted on level 2 facilities. According to disease control priorities, the procedures that has subspecialty surgery, example surgery of congenital abnormalities, should be conducted on a second and third level hospitals or in a level 3 healthcare facilities. Let us always remember that in all facilities, the goal always should be to practice to the highest possible standards of healthcare. That's all. Thank you. Next reporter, please.
Good afternoon, everyone. I'm Grazela Rain M. Betoya, and I'm going to report the three levels of healthcare system. There are three different levels of healthcare system, which are primary, secondary, and tertiary. First is primary level of care. Under this level are devolved to cities and municipalities. Usually, the first contact between the community members and other level of the health facility. Center physician, public health nurse, rural health midwives, and barangay health workers and traditional healers. The first level is when most people need primary care. This level is your first stop for most of your symptoms and medical concern, like acute illness, injuries, screening, or to coordinate care among specialties. Next is secondary level of care. Under this level are given by physicians with basic health training. usually given in health facilities either private owned or government operated. Infirmaries, municipal, district hospital, outpatient departments, and rendered by specialists in health facilities. Secondary care is when your primary care provider refers you to a specialist. Secondary care means your doctor has transferred your care to someone who has more specific expertise in whatever health issue you are experiencing. Next is tertiary level of care. Under this level are referral system for the secondary care facilities, provided complicated cases and intensive care, medical centers, regional and provincial hospital and specialized hospitals. If you are hospitalized and refer a high level of specialty care, your doctor may refer you to a tertiary care. Tertiary care requires higher specialized equipment and expertise. And those are the levels of healthcare system. The majority of the time, you only receive primary or secondary care. However, when you have severe injury, condition, or disease, your doctor will move you to higher levels. Understanding the level of care will help you navigate the medical system and receive the care you need. And that is for my report. Thank you, everyone. Next reporter, please.
Good everyone, I am Glyza May Habinas and I will be reporting the role of each healthcare providers to assessing the quality of healthcare services. So, primary healthcare providers. If you don't have idea who are the primary healthcare providers, they are the people who sees patients that have common medical problems. For example, medical doctors, nurse practitioners, clinical nurse specialist, or a physician. So, the above mentioned are some of the allowed under state law who provide, coordinate, or help patients access to a range of healthcare services. So, they play an indispensable role in healthcare system to prevent and manage common healthcare conditions. They may guide patients to make healthy decisions and recommend treatments depending on the symptoms of diseases that present. So, some of the main responsibilities of the members of the healthcare team includes operate and monitor medical equipment. Of course, we medical practitioners are the one who is assigned to operate for the medical equipment, since we are the one who knows how to operate it. And monitor, why is it important to monitor the medical equipment? Because when medical equipment is clean, accessible, and in good working order, the hospital staff or the healthcare providers will not only becomes more productive, it will also ensure access to safe, effective, and high quality medical devices. So, next is to help perform diagnostic test and analyze result. 'Di ba? When we undergo in magpa-check up tayo, if magpa-check up tayo, for example, nag-undergo tayo ng urine nagpa-laboratory tayo ng ating urine. 'Di ba after that, merong i-give sa atin na papel and we will be asked na ipabasa yon sa mga medical practitioners. Sila ang mag-explain sa atin what is the result all about. Kung ano yung mga kinalabasan ng isinagawang laboratory sa iyong urine. So, since only those medical practitioners know how to read and diagnose those results. So, educate patients and the public about health conditions. So, 'di ba, the one who knew or kung sino yung mas maraming alam is someone who already have the knowledge about those, for example, the pandemic, 'di ba? We listen to the advices of the medical practitioners, wear mask, always kanang sanitize, because they are the one who know what to do because they have studied it already. So, next and last is to provide advice and emotional support to patients and their family members. So, mostly na ang makagive ng advice and emotional support are those who doctors or nurses, since sila yung mas malapit sa patients and family of patients. They can start a conversation, listening to patients and understanding their personal values to assist them and to provide emotional support for them. So, to continue, assessing the quality of healthcare services. So, quality of care is the degree to which services for individuals and populations increase the likelihood of desired health outcomes. It means is instead of worsening the situation, we healthcare providers are responsible to alleviate or to reduce the sufferings of our patients. So, it is based on evidence, professional knowledge, and is critical for achieving universal health coverage. As countries commit to achieving health for all, it is imperative to carefully consider the quality of health care and health services. So, kailangan jud ka ng what we offer to patients is our best because it's part of it's part of kanang mag-promise na to sa atong profession to give a quality service for everyone regarding not minding their status in life. It's either they are privileged or less privileged. So, quality healthcare can be defined in many ways, but there is growing acknowledgement that quality health service should be effective, safe and people-centered. 'Di ba? It is mahibaw-an daw nato siya if quality healthcare siya if it is effective, safe and people-centered. 'Di ba? As what I have said earlier, instead of worsening the situation, you are to alleviate or reduce the sufferings of the patients. So, diba, what does it mean when we say effective? Effective is providing evidence-based healthcare services to those who need them. It means ang imong i-offer na medication is surely the one that undergoes na into kanang research and also it already passed. Parang na-overcome na niya ang challenges ba and it is proven and tested na siya jud ang makaayo ana nga sakit. Safe. When we say safe, avoiding harm to people for whom the care is intended. You are to ensure that, for example, ang imong gihatag nga medication is dili siya the patient is allergic to something. I-make sure nimo nga ang imong ihatag sa iyaha nga medication is katong medication or katong tambal nga dili siya allergy para safe niya nga i-intake, and also dapat right dose ang imong ihatag sa iya, dili sobra, dili kulang, and also dapat on time nimo ihatag sa iya ang iyang medication. That's what it means when we say safe. So people-centered means providing care that responds to individual preferences, needs, and values. So, preferences, di ba? Not everyone can kanang makatulon o kuan, kanang tablet na tambal. For example, just for an instance. So, mas prefer niya ang liquid. So, you have to give him what he needs. Kay, dili man pud nimo siya pwede i-force sa iya kung dili jud niya kaya. So, that's part of their right. And that's part of providing people-centered medication. So, healthcare services must be timely, equitable, integrated, and efficient. Timely, it means reducing waiting times and sometimes harmful delays. O, diba? Just what I have said, when you are to give medications to patients, it should be on time. Kung unsa dapat ang nakabutang, dapat maupod nimo siya nga time, ihatag jud. Kay it might harm the patients if dili nimo na mahatag sa time nga dapat siya i-take sa patients. For example, di ba high blood pressure, di ba ano na siya nga medication? Always na siya or maintenance na siya. So, dapat every now and then nandiyo na siya ginatake sa kuan. If dili na nila matake, there is a big possibility na mo taas ang ilahang ug balik ang ilahang dugo. That's why it is called maintenance. Kaya kailangan na siya i-maintain ug intake. So, equitable. Equitable means providing care that does not vary in quality on account of gender, ethnicity, geographic location, and socioeconomic status. That's what I have said earlier. Dapat, you are to provide those needs of the people in your community regarding their status. Diba? Even if they are not privileged enough, you are responsible, or it is part of your responsibility to give them the medications that they need. Integrated is providing care that makes available the full range of health services throughout the life course. It means you are to provide you are to provide a full range of health services. Dili lang kay pili lang ang imong ihatag. Dapat everything that you can offer, you have to provide it to the people in your community. Then efficient. Efficient means maximizing the benefit of available resources and avoiding waste. Efficient. It means, diba, maximizing the benefit. It means you are to expand the benefits na makuha sa mga tao, sa patients, sa healthcare nga imong i-offer. For example, sa small community, every year kay magdagdag og mga gina-offer nga kuan. For example, for this year, ibot lang ang available ka ng mga dental clinics. Ibot lang ang public dental clinics. So, ibot lang ang available. So, if you are true to your services, mangita ka og way on how you are or how you will be able to maximize the benefits of available resources. How you will going to expand your services. So I guess that's all for my part, and someone from our group will continue our report. I hope you learned something, and thank you.
Finally, we're now in the last part of our reporting. I am AJ Gias Ponilla, and I am tasked with the last part. Now, let's continue. Learning about the components of our healthcare system truly benefits us in many ways. It widens our knowledge about how our healthcare system works, as well as realizing its importance for us individuals and our community. Possessing the said qualities of being timely, equitable, integrated, and efficient can help these healthcare services achieve their objectives. Hence, what are their objectives? So there are the measurements of healthcare quality serves a range of objectives including the following. The first one is providing data to inform quality improvement efforts. So what does it mean? For example, our COVID situation nowadays. Every day, Department of Health or DOH posts updated data regarding a number of COVID cases here in the country. Also, in our region and municipalities, these healthcare facilities inform us if there are improvements in lowering the number of cases, how the vaccine works, and reports on how the conditions of people who suffered from COVID. It is important to have this objective so that we people can be knowledgeable about their quality of assessing our health needs as well as their level of performance to us. The second one is inspecting and certifying that the facility or individuals meets previously established standards. It means that these facilities and their healthcare providers are committed to providing high quality healthcare for us and that it meets high patient safety standards. It gives relief to us if we know that they have been inspected and certified because it signifies that they are truly capable of accommodating our health needs. The third one is comparing groups for a variety of purposes, including selective contracting by purchasers and choice of providers and practitioners by individuals. This comparison will allow them to control costs. If you may wonder what is the connection of comparing groups and controlling costs, the answer is selective contracting. So what does selective contracting means? It is the process of contracting providers into a network and offering insurance packages with varying levels of provider coverage. Theoretically speaking, it consists of having a strong bargaining position that can be used to negotiate lower prices with healthcare providers. In simple terms, it will help these facilities to have lower costs on their resources as well as lowering our costs in availing their services. I know all of us want to save money, so it is really beneficial to us. Next one, informing patients, families, and employees about the healthcare decisions and choices they face. We must be always informed of their decisions or choices for us, since it is our right to know about them. Their decisions are accountable for what may happen to us. Also, the employees must be fully informed of what has been decided. In this way, they are knowledgeable about what to do. Next one, identifying and possibly eliminating substandard performers, those whose performance is so far below an acceptable level that immediate actions are needed. It is vital to eliminate these kinds of healthcare providers since they may cause further harm for us and delays in their services. Hence, if it's still manageable, they must be trained hard for them to improve quickly their performance level and perform their jobs accordingly. But it's much better to eliminate the substandard performers so that we can secure our safety and health. Next one, highlighting, rewarding, and disseminating best practices. It means showcasing and recognizing their performance to its facility as well as to the people. They must have rewarded those healthcare providers who showcase their excellent performance in aiding people. In this way, they can be more motivated to do their jobs for us. Also, they must showcase their best practices in order for them to gain trust from us and to give us relief in addressing our health needs. Second to the last part, it is monitoring and reporting information about changes in quality over time. It means updating the changes regarding their service performance over a period of time. In this way, they can recognize how much they have improved or changed throughout that time. It can be used for assessing what they need to focus in order to constantly improve. Eventually, last but not the least, is addressing the health needs of communities. Obviously, healthcare services must be open in assessing the health needs of the community, since a healthy community benefits every person in it. If the community is ignored their health needs, it may cause further risk to everyone and may affect their living. That's our report for today. We hope that you've gained something from our reporting and hoping it will be used as your guide in learning more about our healthcare system. Thank you so much for lending your attention on us. Goodbye.